Good afternoon, everyone, and welcome to another EEA Ask an Expert live interview from the European Environment Agency in Copenhagen. Today, our topic is climate change as a threat to health, which is very good because we have the COP27 negotiations going on in Egypt, and also we have experienced this massive heat waves in Europe last summer, which we still remember. My name is Antti Kartin, and I'm here with my climate change and health expert colleague, Alexandra Kazmierczak. Welcome to EEA Ask an Expert live interview.
Good afternoon.
And we are here because we just yesterday published an assessment about the health impacts of climate change. My first question, can you tell us a bit about that assessment and what it's about?
Yes, indeed, yesterday we published a report looking at climate change impacts on health, and it's focusing on two major themes. The first theme is high temperatures and heat waves, and the second theme is climate-sensitive infectious diseases. We decided to look at those two themes to cover one of the more established threats. Like you mentioned, we know that heat kills, and we had the rather terrible summer of 2022 in that respect. In terms of the infectious diseases, it's a bit more of an emerging threat. Some of those diseases are coming into Europe, becoming more established or more widespread, and it's something that we need to raise the awareness of. So the report is looking at the climate trends and projections that affect either heat waves or the establishment and occurrence of the infectious diseases. It's looking at who is more exposed through where they live, through work or go to school, who is the most affected by them, as well as some practical solutions and also solutions in policy that we can use to address those impacts on human health.
Very interesting. Let's go into the first theme, heat. In a nutshell, how does heat affect human health?
Well, as humans, we have a very narrow range of temperatures that we can survive with, and excessive heat can affect our health or even kill us. In fact, I came across this scientific article under a title 27 Ways a Heat Wave Can Kill You, because indeed heat can affect so many organs and systems in our body and in so many ways that the health impacts occur in many different ways. The most extreme case is heat stroke, which happens where our body loses the ability to cool down, even through sweating or through transporting more blood to skin. We cannot cool down anymore, and our systems are just shutting down. Also formation of blood clots or things like the blood concentrating in our skin and us becoming very red means that other organs don't have the oxygen supply that is needed. But of course there are also more minor impacts, such as dehydration. Mm-hmm. If you work on a construction site or in agriculture, if you're dehydrated, you might be less concentrated and injure yourself. And in particular in cities, for example, heat mixed with air pollution can become this sort of deadly cocktail, really affecting people's health in a very negative way.
Mm-hmm. So there are actually many negative impacts from heat. Are some of these impacts, are there some people that are more vulnerable than others, or does it kind of impact everybody equally?
Heat impacts everyone, but some people are indeed much more affected. So the people who either have reduced ability to sweat and thermoregulate, such as older people or very young babies, people with pre-existing health conditions, for example, cardiovascular diseases, respiratory diseases, kidney diseases, they might be affected much more. Also, for example, pregnant women, because their body temperature is higher because of the fetus inside their body. And also, of course, people who are, for example, living in cities, they can be more affected through urban heat island effect. Those living in poor housing that is overheating more easily, they can be more exposed to the heat effects and more affected through them.
I just want to remind our viewers who are watching online, either on LinkedIn or Twitter, that you can ask questions from Alexander. We have a team looking at what you're typing in the comments field, and we'll ask them during the interview. We'll continue with the heat topic. Do we have estimates on how many people die from heat or heat waves in Europe?
Well, the answer is that there are too many, because in the European conditions, most of the heat wave related deaths are entirely preventable. The temperatures are not so high, the humidity is not so high that as humans we shouldn't be able to cope with that. In terms of the estimates, there is no consistent reporting on heat-related mortality in Europe, so the numbers we are working with vary quite a lot. At the EEA, we work with data from reinsurance companies, which is drawing information from media, from disaster warning systems, scientific publications, and so on. And that estimates that over the past 40 years, there's been between 80,000 or 130,000 people that might have died as a result of heat waves. This is likely underestimated because the heat wave of 2003, which was the most deadly, cost about 70,000 people's lives. For the summer of 2022, a couple of days ago, the World Health Organization Europe issued a statement mentioning 15,000 deaths based on the reporting from the countries. However, looking at excess mortality during June, July, August, we can see that there's been over 100,000 excess deaths.
So statistically, more people died during that period than we would normally expect.
Yes. So according to Eurostat, across the EU, we can see 16% higher mortality for the month of July, and that translates into 53,000 deaths in July only. The issue is, of course, we don't know how many of them have been caused by heat, whether there have been any other factors, but there are some comparisons against the year 2020, where, for example, the COVID pandemic was much more widespread. The health impacts of COVID were much more pronounced than in this year, and still the mortality in 2022 was much higher compared to this more COVID widespread period.
So indeed, a difficult topic to estimate, but we know that it's a lot, and it's too many. What about the other sort of end of spectrum? Because of climate change, we're also getting milder winters. Would that somehow maybe balance the deaths? Because people die also because of extreme cold, I understand, or because of this you see excess mortality. Are there estimates about that?
It's a very good question, because sometimes, especially being based in the northern countries, we sort of enjoy the benefits of climate change in form of milder winters. However, in terms of the mortality, the numbers we are working with are showing that the winter-related mortality has been much, much lower than the mortality related to heat. So, for example, according to the Center for Research on the Epidemiology of Disasters, over the course of 30 years, there's been about 4,000 deaths caused by extreme cold, compared to these around 100,000 caused by extreme heat. And we can see that projected in the future, that the gains that we can see in terms of reduced winter mortality are an order or two orders of magnitude lower than the additional losses of life we can expect under the climate change. So there is no compensation in this way. It's a small gain against a very large loss of life, unfortunately.
Yeah. This is related to heat and health already. A question from Miklos in Hungary. Should you ride bicycles during hot summer days? Do we know about this kind of like individual behavior and what you can do and what you cannot do, and maybe you're going a little bit also into the kind of mitigating the risks of heat waves and what can be done?
I think that's a very good question and a very difficult one to answer, because there are many factors coming into play here. How hot is the day? How fit is the person riding a bike? I definitely wouldn't recommend it to my elderly parents to get on the bike and cycle in the middle of the heat wave. If you're a fit person, it might be okay to do. However, more and more heat health action plans present in the European countries or individual cities are issuing warnings also to those who are fit, young and healthy, not to do strenuous exercise on extremely hot days. So I guess my advice would be, if there are heat warnings in a given country or a given location, is to follow the advice that is being issued and protect your health first and foremost.
And I think we've seen a little bit of discussion around this even during Summer Olympics, for Olympic athletes, also during the last European Cup football competition. They had to take breaks because of very warm days, the players, and they are of course fit, so it's a concern even for professional athletes.
Indeed.
Yeah. Maybe we move to the other focus area of the report, which is infectious diseases. Why are they a concern?
Well, we can see that under the changing climates in Europe, the climatic conditions might be becoming more suitable for a variety of bacteria, viruses, parasites, but also the vectors that are carrying them, so they can become more widespread or more established.
Vectors
being, for example, mosquitoes and ticks. So diseases carried by ticks, such as tick-borne encephalitis or Lyme borreliosis, can become more established as the winters become milder. The bigger populations of ticks can survive it. The tick season is becoming longer as well because of the milder springs and autumns. And mosquitoes, we can see some mosquitoes that normally are present mainly in subtropical areas, for which the climate in Europe is now becoming sufficiently friendly to establish populations here. And these are the mosquitoes that can carry diseases such as dengue, Zika or chikungunya.
Yeah, but these are mainly known diseases. What do we know about them more? Are they treatable? Are there vaccinations, or how can we prepare for this?
It depends on the disease. There are some diseases associated with bacteria, such as, for example, Lyme borreliosis carried by ticks, and they are treatable with antibiotics. Yeah. A lot of the diseases that are associated with climate change, the viral diseases such as tick-borne encephalitis or West Nile infection, they are not really treatable. What can be treated is the symptoms, the fever, the fatigue, vomiting, diarrhea. You can treat the symptoms but not the disease itself. There are vaccines available for tick-borne encephalitis, but the recommendations or who should be taking them really vary across the European countries. So some countries advise them for children, some people advise them for people in exposed occupations, those working in forestry or agriculture, for example. So it's a really mixed picture. But I would say that, of course, preventing the diseases is a much more efficient approach than treating them. So actually preventing, first of all, the climate change, and secondly, the exposure of people to those diseases through, for example, vector control, controlling the mosquito populations and so on, is much better than treating the disease when it occurs.
And let's stay on that topic, generally about protecting people from these climate change effects on health. What can be done, and maybe what is already being done in Europe? What can we tell about that?
I think what's really important is raising awareness of the issue, and raising awareness among both healthcare professionals, public health experts, but also among the general public. The older generations, they're very tough, and maybe it's important to explain that, the heat waves we are experiencing today are much more severe than the heat waves that were occurring 30 years ago, and maybe the behavior should be should be adjusted a bit.
And you are also 30 years older than you were doing not you, but the
Exactly.
older person.
Exactly.
Yeah.
So taking into account the personal vulnerability and also the changing climate, and that it's not the same situation as it used to be. I think it's very important to monitor what's happening and issue warnings based on the available data. So the warnings relating to extreme weather events such as heat waves, but also monitoring the occurrence of the diseases and the outbreaks and issuing warnings when they occur. There are also some more practical approaches that could be taken in relation to heat in particular. Greening our cities, having more green spaces, trees that can substantially bring the temperatures down, but also using solutions such as creating cool spots for people, such as public libraries or public buildings where people can go and cool down, or using sustainable cooling systems. In fact, today we had a briefing at the EEA published on sustainable cooling systems, so that links to the subject.
Because that's also becoming an issue. We need more and more some kind of cooling of our buildings, but we need to also make sure that that's sustainable, that we're not using more energy for that, and also more efficient solutions.
Indeed, that might be the sort of the most important thing to do, really, because we tend to spend about 90% of our time in buildings. So making sure that the buildings are protecting us from the heat rather than exacerbating the heat is really a key issue.
And you also mentioned urban areas. Why are they specific to this problem?
Well, in urban areas, the high concentration of buildings, the low proportion of green space, also the production of heat, for example, from traffic, from cars, it tends to create the so-called urban heat island effect, whereby the temperatures in cities are higher than in the surrounding areas. So that adds another sort of layer of heat on top of the heat waves. And what we found, for example, in the report is that looking at the hospitals located in urban areas, nearly half of them are located in a strong urban heat island effect. And 4 out of 10 schools tend to be in those hotter areas. So that really brings the urgency of adapting those facilities catering for vulnerable people to the changing climate.
And there's actually a follow-up question on LinkedIn on this. This is from Kasia. She's saying thanks for this session and wants to know what would be the 3 most effective measures to cope with climate change in cities. Can we rank, or maybe a few few very effective ones? You mentioned green spaces, for example.
Yeah, that's a very good question, and I guess it's also very tricky to answer because looking at Europe, we have such a diversity of cities in terms of the geographical location, in terms of the way they've been built. So it's very difficult to compare the sort of town center of Barcelona against Helsinki, for example, in terms of what they look like. But indeed, urban greening and interventions in the built environment seem to be the most effective measures to protect people from excess heat. Yeah.
And they also have many other benefits, including green spaces. I think for air pollution and noise.
And noise and general health and well-being of people.
And we like green spaces in cities in general. There's another question from Firat and asking, are there parts of Europe that are more prepared than other areas or better adapted to handle impacts from heat waves? What do we know about the sort of the progress countries are making to adapt and take action?
In general, Europe is preparing well for climate change. As of 2022, all of the European countries that the European Environment Agency is working with actually have their national adaptation strategies or plans or an equivalent document. So there is the policy baseline in place allowing for adaptation to climate change. We also see a lot of progress at the local level. For example, there is this initiative for local authorities called the Covenant of Mayors for Climate and Energy, whereby the city mayors or the mayors of other local authority commit the city or the locality to both mitigate the climate change but also to adapt. So I think on adaptation there's about 4,000 local authorities across Europe that have signed up for the initiative. What we know a bit less about is what is actually being done.
Yeah.
We know about the policy, we know about the commitments. However, it's very difficult to actually assess the levels of implementation in place. There are several sort of champion cities, for example, across Europe. Paris is doing a lot about preparation of heat waves, I guess still in the wake of the 2003 heat wave that caused so many deaths in France and in Paris. Cities like Rotterdam are pioneering a lot of solutions adapting to flooding and the risk of sea level rise and so on. Yeah. But it's difficult to pinpoint who would be the sort of the absolute leader.
Many of these actions are very local as well, so they're kind of scattered, not only on national level but cities doing things.
Yes, the adaptation to climate change tends to be local by definition, because it's we adapt to a combination of the climate hazards and the characteristics of the area we are looking at. So the responses need to be local by default to actually address the risk that emerged.
Yeah. Here's a question from Oliver. He's asking, how can or should teams or fans or tourists preparing for the World Cup in Qatar, I think he's referring to air quality as well, that being worse there, prepare for those events. But maybe we can raise this kind of to a more general level about what can individuals do in general, if we stick to the topic of heat waves here. If I want to kind of protect my health or my family, what can I do to prepare for it?
Yes. I guess it's a bit like, being on the plane and, putting the air mask on first and then taking care of the others. So first and foremost, take care of yourself. And if there are any extreme weather warnings issued, then follow the advice coming from the authorities in terms of avoiding strenuous exercise. If there are warnings coming about high air pollution levels, especially when combined with heat, don't go out jogging and avoid being outside if you are more vulnerable. The second thing you can do is to take care of the vulnerable people around you. Check on the elderly relatives if they're okay. Knock on the doors of an elderly neighbor, checking if they are cool enough, if they need anything, and make sure that they are also aware of the risks. And I guess the sort of more longer term actions that could be taken by the individual, and go and bother your local politicians, your city mayors about the solutions that can be implemented, about reducing traffic, about having more green spaces, having drinking fountains, having open public buildings with air conditioning where people can shelter during heat waves and so on.
Yeah. More questions coming in. This is about high temperatures. It's an interesting one. Are high temperatures always causing more infectious diseases, or can we get some areas with less because of too high temperatures? So can heat also, heat in sort of climate sense, kill bacteria, viruses, or these vectors in a way that is beneficial for us?
Yeah, that's a very good question. And in general, climate change have been observed to exacerbate the climate-sensitive infectious diseases in general much more than reduce them. So there's been a study looking at the global distribution of diseases under the changing climate, and 2/3 of them were aggravated by climate change, and only a small percentage of them were actually reduced. Mm-hmm. But when it comes to the temperatures, indeed we can see that in terms of the projections of the climatic suitability for tiger mosquito, Aedes albopictus, so that's the mosquito that can spread dengue, Zika and chikungunya. in Europe, we can see that at the moment the suitable areas, for example, like North Italy and so on, under the high emissions climate scenario, they become not suitable for the mosquito, and the suitability is moving much more to the northwest of Europe.
Because of drought?
Because the area is becoming too hot and too dry for the mosquito
okay,
populations to become established. So indeed, we can see this shift in the future projections where the epicentra of certain vectors or diseases can occur.
Very interesting. There's a question from Hayar, and it's talking about the health situation related to climate change and drinking water in about the most affected regions of Africa and Asia. What are the measures, and is it a health emergency for you? So I guess in Europe. Do we know about drinking water quality, or maybe water quality in general, and climate change?
In general, in Europe currently, we are enjoying a very good quality of drinking water and very good quality of bathing water as well. However, under the changing climate, of course, we can see some negative effects, and that's a topic that we're going to look in much more detail in the future. That we can expect, for example, higher concentration of pollutants as the water scarcity becomes a problem. We can see issues such as saltwater intrusion into the groundwater aquifers due to the sea level rise. So in the coastal areas, some of our groundwater that we're using for drinking might become not usable, or might require certain treatment. We can see, especially in the Mediterranean countries, that the water scarcity is becoming a problem, and solutions such as purifying wastewater and using it for watering green spaces in cities, or street cleaning, rather than using the potable water is being used. So I think it's definitely something that is ahead of us in Europe, and that we should be looking closely at, because in the future we're likely to be much less comfortable in that respect than we are now.
We have done almost half an hour. It's been very interesting. Maybe as the last couple of things, what else is coming out from the EEA in this area, and what else the EEA is working on, or any other last comments on this topic that we didn't touch upon?
Yes. So the report that was published yesterday is a bit of an entry point to a larger repository of knowledge. So we have this portal called the European Climate and Health Observatory that includes a variety of information about climate change impacts on health and on the solutions as well. So we have indicators, we have policy analysis, we have case studies, we have brief evidence overviews on, for example, climate change impacts on mental health and so on. So it's really a wealth of information, and if anyone from the audience is interested in learning more, I would encourage you to have a look at the portal. So
we'll post links in the chat as well, so you can follow those if you want to find more.
So we continue working under the umbrella of the Climate and Health Observatory on a number of issues. So we will be having more information about the infectious diseases in the portal soon, information about how pollen situation is looking like, and how it's likely to change under the changing climate, and a number of other topics. So watch this space.
Very good. Any other last thoughts that we didn't touch upon? How can we go forward?
I think the scope of this report is limited in a way that it's looking at the climate change impacts on health and how we can adapt to the changing climate. But first and foremost, we should be doing our utmost to actually reduce the change occurring in the climate. So I have high hopes for the ongoing COP27 and for reaching an agreement that would keep us as close as possible to the 1.5 degrees Celsius, rather than following the scenario towards 3 or 4 degrees. That would be truly catastrophic for human health and well-being, of course, not just in Europe, but in all the world regions. So fingers crossed that we get somewhere this year.
Very good. Thank you very much, Alexandra, and Thanks everyone for watching. We will be back for more very soon, so watch our LinkedIn, Twitter and Facebook channels, and thanks for watching again.